Roll call, Cassandra, please.
Legislator Hathaway. Legislator Verkler. Legislator Mosier. Legislator Gilbert. Legislator Chartrand. Legislator Moorhan. Legislator Leviker. Legislator Osborne. Legislator Nellenbach. And Legislator Dahlhoff.
Here. Please stand for the invocation and the pledge. Legislator Gilbert, would you lead us in the invocation, please?
Heavenly Father, we give you praise for the blessings you've bestowed on our country and community. Thank you for this warm weather and the successful harvest through this fall season. Bless us and our leaders with wisdom, courage, and reverence as we execute our duties. Amen.
The September 5th board meeting minutes are approved if there are no amendments. Report of the Finance and Rules Committee per Rule 6. Cassandra, please.
Mr. Chairman, if it's okay with you, I'd like to go back to the proclamation.
Oops, sorry. Okay, go.
The proclamation commemorating Lead Poisoning Prevention Week, whereas the week of October 22nd to the 28th of 2023 is National Poisoning Prevention Week, and whereas nearly 500,000 children aged 1 to 5 living in the United States have elevated blood levels that may cause significant damage to their health, estimates the Center of Disease Control and Prevention, and whereas children can develop behavior and learning problems such as hyperactivity, slowed growth, hearing problems, and aggressive patterns of behavior. And whereas the primary source of lead exposure among U.S. children is lead-based paint and lead-contaminated dust and soil found in and around old deteriorating buildings. Whereas children can also be exposed to lead from additional sources, including contaminated drinking water, take-home exposures from a workplace, and lead in soil. And whereas, despite the continued presence of lead in the environment, lead poisoning is entirely preventable. And whereas stopping a child's exposure to lead from leaded paint, house dust, or any other source is the best way to prevent the harmful effects of lead. Now, therefore, I, Lawrence L. Dahlhoff, Chairman of the Lewis County Board of Legislators, do hereby proclaim the week of October 22nd to 28th, 2023, as National Lead Poisoning Prevention Week in Lewis County, New York, and call upon the people of Lewis County to observe this month by helping our families, friends, neighbors, and leaders better understand the importance of public health's efforts to decrease this most preventable disease among young children by raising awareness about lead poisoning and to ensure lead-free kids for a healthy future.
With us, we have Emily Ward. Would you please, as the lead coordinator from Public Health, would you please come forward and receive this proclamation? Okay, report of the Finance and Rules Committee per Rule 6, please.
Thank you, Mr. Chairman. The Finance and Rules Committee has met and they recommend to waive rules to act upon late resolutions.
Need a motion for that, please, Lisa. Second by Andrea. Any discussion? All in favor? Anyone opposed? Motion carries. Privilege of the floor. Is there anyone from the public that would like privilege of the floor? Seeing no hands, we'll move on to clerk of the board report. Cassandra, please.
Thank you, Mr. Chairman. A resolution was received from Orleans County titled Supporting Senate Bill S-7645 that repeals certain provisions of the executive law establishing a fee for background checks on certain firearm and ammunition purchases. That concludes my report.
Thank you. Standing committee reports. We'll start with Finance and Rules. Legislator Osborne.
Thank you, Mr. Chairman. The Human Resources and Civil Service Office has been busy with ongoing negotiations for the CSEA General Unit, assisting in the 2024 personnel budget requests and supporting the retiree health insurance change. The team recently updated the orientation process, planned leadership training for department managers and supervisors, and had organized a benefits fair for employees to learn about their various benefits offered beyond medical, dental, and vision coverage. They have given 16 civil service exams, onboarded 36 employees for full-time and seasonal positions, and continue working to fill 15 vacancies. Anyone interested can go to the county website at lewiscounty.org for job postings and exam announcements. That's my report, Mr. Chairman.
Thank you, Tom. Any questions for Tom? If not, we'll move on to General Services Committee with Legislator Gilbert.
Today marks the official opening of the new highway garage facility on the East Road. This facility is an enormous step forward for the county. Trucks and equipment have gotten bigger and more sophisticated since the original garage was built over 100 years ago. The new facility will allow the highway department to better wash and maintain the county assets and will allow us to bring the workplace up to today's standards for safety and excellence. And we certainly thank everybody who came out today, and especially the highway workers for taking the time out of their busy schedules to be there. That concludes my report.
Thank you. Any questions for Ian? Thank you, Ian. We'll move on to Health and Human Services with Legislator Berkler.
Thank you, Mr. Chairman. Some updates about Department of Social Services. And Jenny, I am going to have a question for you here. The child care subsidy eligibility increased to 85% of the state median income effective October 1st. This means a family of 4 can earn up to $99,205 annually and still be eligible. Jenny, this can be used at any certified daycare as well as family members if they get certified, correct? Right, so this can be used for family members who watch children. Yeah. Okay, thank you. Also, HEAP is ramping up for the cold weather season with early mail-out applications already sent out and many returned. Regular HEAP opens November 1st and payments to vendors will be made in the month of November. It's a very busy time for DSS there. And also the Lewis County Warming Center opened October 1st and will run continuously from October 1st to April 1st from 7 p.m. to 7 a.m. every single night. There are 2 staff members from NERCL again this year supervising each night. And the center is in the New Beginnings building on Jackson Street, right in downtown Loudville. And this concludes my report. Thank you.
Thank you, Chairman Larry. We had an Employee of the Month for June, Mackenzie Guterman, RN. And if you see Mackenzie on her days of travels, please congratulate her and thank her for the work that she does. We had the 43rd Annual Haney's Conference in September 21st through 23rd, and we had half of our members make it. So we try to go about half each year, and that keeps us up to date on the changes in healthcare. This year's conference encouraged the leaders and boards to not only focus on midterm planning in the 3 to 5 year time frame, but to take a longer view of 8 to 9 years. Additionally, they had a cybersecurity session that gave some pointers on how to avoid getting ransomware. A couple of years ago, Samaritan had a attack and they were down for 36 days. We had a gain of 229,848 versus a budgeted gain of 556.91 for the month of August. The year-to-date gain is 73,617 versus a budgeted loss of 231. That would just about ensure us of a positive year-end outcome. And in this time of everything going up, that's quite a record to have because it sure as heck isn't business as usual. Okay, and at this time, I'd like to introduce Jerry Kayer for CEO of the hospital. He's got some remarks.
Here. And what we are expecting in healthcare from our board on what the average volunteer board would be expected to get. And I think that's something that we in our organization do not lose sight of. And there's a great deal of complexity in the world of governance now. And this notion of having a one-year work plan based on a 3 to 5 year strategic plan, and the formula that represent legislative Sarkan, the ability while that's going on, trying to predict what will be out there 10 years, and building our financial capacity to be able to adjust to that 10 years from now. So it's a fascinating conference, and I'm very grateful for the presence we had of our board. And additionally, one of the keynote speakers was Commissioner McConnell from the interesting background. I think he brings a fresh perspective, and is working through being a new commissioner because, you know, it doesn't matter what sector of healthcare or social services you're from. When a new commissioner comes in, we're all lining up asking for it, right? So sort of working our way through that. But it was a chance for members of our board to at least get introduced to the commissioner. I also want to follow up on Dick's point. We will, our budget projections for 2023, and it sheds a great deal of pride on the team, on the health system campus. We are our first year post the pandemic, and we're navigating. So we are nearly complete on the FY24 budget. We still have some tinkering to do. It goes to the board of managers, and also to the finance committee. So we'll be prepared after our board meeting to present it. With regards to the project, at this point, we're moving along nicely. It looks like we will have an end date of March 6th, 2024. That's 9 weeks later than our initial schedule that is projected. And so the 3 principal reasons are supply chain, and we're still waiting for things now that we're ordered into the electrical panels. We've heard that about the projects, the generator. A generator we're having to do with the company. They're in Texas and the place going down. So they have to start all over again at that site too. Those are just sort of the on the ground practicalities. The other is skilled labor. There isn't a day that goes by where not the construction teams are not fully staffed. And over the last few years, we became accustomed to healthcare having labor challenges. We became accustomed to education having labor challenges. In this project, they are struggling in the trades and making sure that the project is well staffed. So that's another reason that we're working through some of these challenges. But when I look at the totality and complexity of the project, there are days, 9 weeks, like, man, we missed the mark. Then there are days, I think, only 9 weeks. And, that's the way we have to approach it. Our goal is to have a surgical procedure in the new ORs before the end of the month. And there are some things that have to happen before then. One is the Department of Health has to come in, and their schedule coming in these next 2 weeks. And it assumed that there's something that they don't like, we can turn it over pretty quickly and then they do the case. If not, it will be November. I'm not willing to say November because what'll happen, human nature, if I say November, it'll be November. So we still keep it for October. On medical surgical, a lot of work has happened. Half the unit is being used, as I reported to you previously. The other half, which is the east side of the east wing, which is the State Street side, next week we could be doing flooring, which means all of the other things work for me. So it's coming along, and I extend to any of you, if you want an updated tour, let me know. And, best time is after 3:00. You don't have to wear a hard hat. If you come before 3, that's okay. You just have to wear a hard hat. One last thing I wanted to just remind the legislators, if they haven't received their invitation, you will be receiving an invitation to this year's gala. The foundation has capital campaign to support the new structure, and the gala, the proceeds from the gala are supported for the campaign. This year, it's on October 14th, a Saturday at Tug Hill. And it's an evening that includes hors d'oeuvres, adult beverages, silent auctions, and live music. So, last year, earlier this year, we had a very successful gala at the Elks Club, very well attended. We had gone 2 years without one because of the pandemic. But you could just tell people were thrilled to be together. Good energy. And this year, I think the same. So, if you want to know more about it, any questions for me tonight? Do you do the entertainment for the music? I think I'm quite humorous and tell great stories, but I have 2 daughters and a son, and they remind me it's only in my mind that it's humorous and entertainment. So I can assure you none of that.
Thank you, Jerry.
Okay, Chairman, we also had one of our doctors pass away in the last month, Dr. Gerard Crawford, and we held a moment of silence to honor him. He was an outstanding employee and leader in the community, and we have a doctor in the process of joining us that will put us back where we ought to be even on that. Barring questions, that's my report.
Any questions for Dick? If not, our project managers, Jim and Nick Garrido, are here to give us an update on our projects.
In my career, once, maybe twice, I ever allowed job in order to working in the building for standard practices. The contract is finished, everyone's happy, the order is good. But in this particular site, it's different. It's a reasonable time. history. It's a good concept. So if we had down there, that contractors working in the area, finishing up, and Tim's moving in. That's not the norm. It's basically, I think it worked out real well. I didn't see issues today. I think we don't need to cut this law. So that's not the norm, but something that is good with project. We have a good client, good contractors. The other thing that's happening is start working the other buildings, public services. Get lost. Then, response. Well, then it's kind of better. We have some exact quantity that we didn't do the unit price and we did, we had a contract with two quantity, yeah, plus some of that, we have lots in it. So what happened to that is, if anything survey, they have quantity. Monthly pay, then we'll start the union, three people, having it up to one, that's all started. All the, all out, and very outside. Sit down there. Timing on knowing about the rock. I thought the same thing about it, just definitely. You know, glass.
But the unit, excuse me, the unit price we had was 150 per cubic yard, right? So even if it was 500, very large, that'd be like 75,000. So, I mean, it's not gonna upset the apple cart of the project, but it's probably more disruptive in terms of time, quite honestly.
Any questions for Nick and Jim? Thank you. Next up is the county manager report. But before I turn it over to Ryan, we have a brand new system here, and I'm told that I can mute Ryan if we need to do that. So I think this will be a particular interest to Tom and Phil. So if either one of you just give me the signal and we'll end the pain. Take it away, Ryan.
I'm not sure if I should say thank you, Mr. Chairman, after that one. I'm just glad that Phil and Tom don't have the button to cut me off. Yeah. So as Jerry mentioned, we're cruising along with our budget planning as well. At this point, all of the departments have entered their line items into Munis. So Eric and I have started the line by line review where we go through and make sure that each of the line items match our notes from our conversations with department heads, and that typically takes some time. The other outstanding item for the budget yet is some personnel items. As I had mentioned at Finance and Rules Committee last month, we had like 60 plus personnel requests this year. Typically, we're dealing with less than 20 personnel requests. So we're trying to give them all the same scrutiny that we would in a normal year, and it's just taking a little extra time. But the capital budget, which already was presented to Finance and Rules Committee last month, that's entered. A lot of the state formulaic changes and those types of things have been entered, along with our main revenue estimates. So we're very close. We've just kind of got to tie down some of the details. And of course, we'll present our full budget, at least the budget workshop on the October committee meeting, and then the tentative budget will arrive on your desks for your review, amendment, and approval at the November board meeting. So we are on target for another on-time budget here in Lewis County. However, I was at the NISAC conference in Oneida a couple weeks ago, and as usual, we got an opportunity to learn about what's going on at the statewide level. And there's some items that I think would be valuable to bring forward to this board that I learned at the statewide conference. So there's a couple documents that I can make available to those that are interested. The first is the NISTAC budget review document. So a lot of the information I'm going over is all stuff that they publish in a document. Then the other is a document on the changes to in-rem foreclosure. So basically the county foreclosure process is going to significantly change due to the Supreme Court ruling. So we've been taking steps, but some of the bigger counties, that's a big revenue, for them. So anyway, a couple things on the state's finances that I think are of interest. The state at this point, their 4-year projected deficit is at $36 billion. They do have, however, $19 billion in reserve, which is the highest reserves they've had in a long, long time. So you're going to hear a lot, I think, out of Albany, crying poverty. That's politics. They do have some money in the bank. The annual state budget at this point is about a $230 billion annual budget. So in terms of, a fund balance as percent of spend, far less than what we would feel comfortable with, right? But for them, far better than they've had in a long time. Medicaid continues to be, the main driver of the state budget. At this point, it's a $110 billion annual program, which is massive. It's grown 50% over the last 5 years, and it's projected to grow another 50% over the next 5 years. So that's nearly doubling in 10 years. Similar with K-12, K-12 education dollars have doubled over the last 5 years, and they're expected to go up an additional 35% over the next 5 years. So those two items alone are huge, huge spends on the state budget. Medicaid is a big deal because the counties have a share in that. So at this point, our full Medicaid cap is 5.2 million. And that's what we are budgeting for this year is the fact that we're probably going to be tapped for our full cap, $5.2 million. That's the most that the state can ask counties to spend. However, we feel, some of the folks at NISAC, that it's highly likely that with the state's projected growth in Medicaid, they're going to have no choice but to come after county governments and property taxes for more, basically raising the cap. Remember, we went to Albany a few years ago with the whole keep the cap, I think that fight is going to be coming back. In fact, last year, going into this budget, the state has shifted another $625 million away from counties to their Medicaid budget. So that is a big deal. 800,000 of that is what we expect in Lewis County. So, that's not an insignificant hit on our budget. In 2023 and the 2024 state budget, there is an additional $588 million of cost shifts to counties. So what they do is they create these programs, and if you look at them each individually, they may be programs that we could agree with, things like pre-kindergarten, foster care, but they slowly reduce their commitment and increase the county's commitment over time. And so that's kind of the game that continues to be played. If you look at just the additional cost shifts from last year, it equals 11% of all property taxes in New York State, just additional cost shifts. So the state is increasing, the requirements that we contribute to these programs at a rate that is nearly 3 times the tax cap that we have eligible to us. So think of that. They know that we have to now tap into sales tax and other revenue. They've seen what the county's sales tax receipts are, not just Lewis, across the board, and they know that we have money, and they're starting to shift that, those costs to us. Like I said, the total, all programs combined, cost shift in 2024 is over $12 billion from county governments. So I think that we've got to continue to stay engaged with the state. I think that there's more fights ahead of us than behind us. We've got to keep an eye on this Medicaid thing because the state knows what we're bringing in sales tax, and they know what their Medicaid commitments are, and don't think that they're not, putting 2 and 2 together, because they are. The last thing I want to add is just to echo Jim and Nick's comments about the DMV. Just a special kudos to the DMV staff for being incredibly flexible during that move. The IT staff being incredibly flexible, building and grounds really busted their butts to get that done. And then I'd also like to recognize the Development Authority of the North Country that was really flexible in getting fiber hooked up to that building. We were on a timeline with the state trying to get their servers up and running. We kind of had to jump whenever their IT folks were available. And so everybody was flexible to do that, and we're grateful for that. And then again, echoing Ian's comments about our highway staff, if you went through that building today, you could eat off the floor in there. And I suspect that's a standard that they're going to want to maintain. These guys are incredibly proud of the work that they do for the county. And I'm proud that we gave them a building that, hopefully gives them the tools that they need to do the job well. And the last thing that I'd like to say is this is Matt O'Connor's last meeting. And I just, we really owe a great debt of thanks to Matt. The work that he has put in during this capital project has been, above and beyond every step of the way. Really rose to the call of duty, motivated his staff. I think Jim was telling me earlier today, it was Matt himself was tinkering with window locks and things. No stone was left unturned for these projects, and the time and effort that Matt put in was really above and beyond. So I just wanted to say, thank you, Matt, and best of luck. And, you can always come back to us.
Brian, you had about 3-1 last thing.
I was testing the new system.
When you said 5.1 million on the Medicaid in this year's budget, did you mean 2024? I just wanted to be sure.
Yeah, 5.2 actually, I think, is what we plugged in for 2024. So it might be a little short of that, but basically over the next few years, we're going to be right up against our state cap. So.
So did I hear you correctly that almost one half of the state budget, $110 billion is Medicaid out of a $230 billion budget?
That's the material that NISAC provided to us, yes. And that's part of the reason why Medicaid's so hard to change, because it's a behemoth program. You know, you can't turn it on a dime, right?
Any questions for Ryan? Thank you, Ryan. Truly, thank you. And we'll move to the county treasurer report. Eric, please.
Thank you very much. I've provided the normal monthly written report. Just a couple of comments. As Ryan noted, budget's moving along and definitely a large part of the time effort during this portion of the year. Our Medicare Advantage transition for our Medicare eligible retirees is also moving along. We had a good informational meeting about a week ago. And just doing the best we can to provide as much information as possible to all interested parties on this process. United Healthcare will be rolling out their informational and enrollment meetings very soon. Those are scheduled on October 13th, 16th, 17th, and 19th. We'll keep you informed. You are welcome to attend if you'd like to learn a little bit more yourself. So that'll be an important part of the process, and then just continue from there on to actual enrollment for those retirees. So looking forward to that process continuing. I think one other note, our investment consulting services from 3+1, we renewed their contract a month or two ago. We're starting our 4th year with them. Had a quarterly phone call with them today, and just really continue to see I think the benefits of that process and their guidance. We've given the funds that we have available and given the interest rate environment, the expertise to get the most out of that money is incredibly beneficial. I think our team, we have 2 other people in our office that work with me on that. We're learning a lot, and it's really getting as much out of our money as we can. It's interesting how they kind of push us to use the funds effectively, and it's challenging to, we're pretty conservative people, but to go along with their recommendations, but we're doing the best we can, and I think it will continue to work out for us in the future. That's all I have.
Any questions for Eric? Thank you. And we'll move to the report of the Financial Rules Committee per Rule 7. Cassandra, please.
Thank you, Mr. Chairman. The Finance and Rules Committee reports that they have examined the claims presented for payment in the total amount of $2,019,556.10 and recommend that they be audited and allowed for the amounts claimed.
Someone like to move that? Lisa? Do I have a second? Dick? Any discussion? All in favor? Anyone opposed? Carries. Consent resolutions. We are going to pull the individual resolutions 177, 183, and 193. Are there any others that people would like pulled to vote on individually?
I don't care to pull it, but I just want to clarify something with Jones. Resolution 186,
Okay.
that's the retiring resolution. It reads as if it will I'm assuming the way it is read here, that it would take board action not for the savings to go into the health. Is that accurate?
Yes, in the shared savings that we're expecting.
I felt like that was the case. Thank you.
Further, once it's in there, I don't believe we can take it out. Is that correct, Joe? Okay, anyone else have any other resolutions they'd like to vote on individually? If not, could I have a motion to move the consent resolutions? Jessica, second by Josh. Any discussion? All in favor of the slate? Anyone opposed? That carries. We're back to 177.
Resolution number 177 is auditing and allowing claims in the amount of $2,019,556.10.
Moved by Lisa, second by Andrea. Any discussion?
I just have to recuse myself from the portion about public defender that has to do with the assigned counsel for payment to myself as the assigned counsel administrator and payments to various attorneys where I approved the vouchers.
We have that noted. Okay, this is a roll call.
Legislator Hathaway? Legislator Mosier? Legislator Chartrand? Legislator Leviker? Legislator Osborne? Legislator Verkler? Legislator Gilbert? Legislator Moorhan? Legislator Nellenbach? And Legislator Dahlhoff.
Yes.
The next one is resolution number 183, and it's the resolution directing the demolition and removal of an unsafe building pursuant to local law number 2-2007, Village of Turin.
Mr. Chairman, if I could be heard on that before the board considers this.
You may.
I did speak with the owner of this property who is out of state and actually out of the country right now due to his mother being gravely ill. He was credible, respectful, and called and spoke with me a number of times. So he requested that the board consider an adjournment of the hearing until the November 7th meeting, and he will be present here to address the board and tell us what, if anything, he's going to be able to do to remedy the situation on the building. So I would request that the board consider withdrawing this and rescheduling it for the November 7th meeting.
So go ahead, Dick. It's introduced by Ian, so does he need to?
It doesn't matter.
Okay. So let's move by Dick, second by Ian. Any discussion? All in favor of pulling this from tonight and moving it to the November meeting, correct?
Correct. The first November 7th meeting.
All in favor? Anyone opposed? Carries.
Resolution number 193 is a resolution to authorize I Love New York campaign matching funds and designate Lewis County Chamber of Commerce as the county's agent to supervise promotion and marketing of the campaign. And the reason that this was pulled, it is just a error that the year 2023 should actually be 2024 in this resolution.
Moved by Lisa. I have a second. Phil, discussion.
That's moved with the amended language? Okay.
All in favor? Anyone opposed? Carries. That's the end of the resolutions. Do we have any other business? Motion to adjourn. Dick, second by Phil. All in favor? Anyone opposed? We're adjourned.